This bridging of the gap that you're seeking, what is that all about, and what don't we as potential patients understand about this gap, and how can we bridge it?
So what we like to do in our area is talk about prevention, to prevent or slow down the need or decrease the need of every American to see Dr. Clapper or other doctors. So we talk about things like appropriate nutrition. So if we're talking about osteoporotic hips, do you need to be concerned about that as a postmenopausal woman, a woman over the age of 52, or should you have a daughter who's 10 years old? And the answer is you should be concerned about it if you have a 10-year-old daughter, or maybe even a 6-year-old daughter, because laying down appropriate bone mineral density starts at that age. It's not a starting point when you're 40 or 50 years old. That's a little bit late to start being concerned about it. So in our area, we talk about, well, what does that look like? What does it look like with regard to nutrition? What does it look like with regard to appropriate physical activity? What kind of loading should you be imposing on the bone in order to have it mineralized correctly? What may be some issues that you might have to deal with as you get older that could cause regression of bone mineral density? What kinds of potential drugs, over-the-counter drugs or pharmaceuticals that Dr. Clapper talked about, and also accelerate aging of the bone. So that's the analogy that we're talking about bridging. We talk to our students. I see a couple of them in here. They can probably give you more pointers on it. But for them who are interested in going into medicine, what kind of proactive things can they do with their patients or the families that they deal with if they work in family medicine to try and delay? We call it compression of morbidity. The average American spends the last 13 years of his or her life in a diseased or disabled state, and it's very costly to be in that place. So we try to compress morbidity, reduce the amount of time you can spend in a diseased or disabled state. And that's really, what it really comes down to is the lifestyle choices you make. And those are nutrition, physical activity, they relate to community and social things as well, psychological health, there are all those factors, but the two primary building blocks that sustain that compression of morbidity are appropriate nutrition and appropriate physical activity or exercise.